I think outside of a healthy lifestyle, that optimizing hormones for women with HRT is probably the best thing that you can do to improve long-term health and longevity. I think it is better than almost anything else that we have out there outside of lifestyle. We've had 2 decades of women who've lost out on the benefits of estrogen and progesterone and even testosterone. They could have had these benefits and they didn't. And it's really, really heartbreaking to me.
So we often hear about men having their longevity stack, so to speak. Maybe it's TRT, creatine, their VO2 max training, of course, cold plunge and sauna, their 8 sleep. But what about women? What should women have in their longevity stack?
I think a lot of the same things. Unfortunately, we just don't have the studies on women that we do on men. Women weren't added to the studies really until the last couple of decades. And so almost all of what we know is about men. And so we kind of have to extrapolate and say, does this apply to women as well? And a lot of times we think probably, but we don't actually know for sure. But certainly like creatine is great for women. We know that that's great for bone health and as well as, for brain health as well as muscle health. I think some of the things that people love, we're just not sure if they're as good for women. Like we don't know if cold plunges are good for all women at all times, for instance. And we really have no idea. Like this is just some people say it makes them feel great. Some say it makes them feel horrible. And I think that that's more true in women than it is in men. From what I've heard. I like a lot of the things like red light therapy. I love for women and for men. It's great for skin. It's great for, blood sugar, a lot of things like that. I think that some of them, building muscle is important for both men and women. VO2 max training. I think there's been a lot of talk, I think in the last few years about, increasing your zone 2 training and things like that. But I think that with women and with men too, but especially for women, we need to focus more on, really increasing like our sprinting and our HIIT intervals and like going hard for short periods of time. So I think a lot of women don't do that. And that's actually something that's more important probably for us than these long sort of spaced out, zone 2 workouts. So those are a couple of things.
Yeah, and a couple I'll call out. So you mentioned the cold plunge. We've had Stacey Sims on the pod, and she made a point of saying, women should be 10 degrees warmer than men. So don't opt for 40. You should probably opt for 50 degrees. And then echoes the same sentiment on zone 2. She says we talk so much about zone 2, but women, especially as they're approaching middle age, should probably focus more on sprints.
Yeah. I think, and it's funny, I follow Dr. Sean Omar. I don't know if you know him, but he's all about sprinting. And so in the last year or two, I've decided I'm going to go sprint, so I'll go to the track and I'll do these sprints. And my kids laugh at me because they're like, Mom, you're like barely jogging. Like you're not even sprinting. I feel like I'm sprinting, but we get out of that sort of sprinting mentality and that like go as hard as you can mentality as we get older, I think. And so it is important to still do those kind of things if we can.
We also touched on hormone health, for men, TRT, for women, HRT. And can we spend some time talking about hormone health and the 180 I think we've done there and this realization that hormone health is longevity?
Yes. And I say, I think outside of a healthy lifestyle, that optimizing hormones for women, with HRT is probably the best thing that you can do to improve long-term health and longevity. I think it is better than almost anything else that we have out there outside of lifestyle optimization. And as you mentioned, in 2002, when the Women's Health Initiative came out, everyone was scared of hormones, right? It causes breast cancer and dementia, and it causes, heart disease and all these things. And of course, we know now that was sort of a misinterpretation of the study. But unfortunately, the media from that event 22 years ago, it was so strong and so prevalent, that message that these are very dangerous, that women still today think that hormones are dangerous. I still have tons of people that I talk to, even my mom, that thinks that hormones cause breast cancer. And so unfortunately, this messaging is still there. And I think that we've had 2 decades of women who've lost out on the benefits of estrogen and progesterone and even testosterone, where they could have had these benefits and they didn't. And it's really, really heartbreaking to me.
And so for someone listening, and we've talked about this before on the pod, but I think it's important to reiterate, how should someone think about that process? At what age should I start thinking about HRT? What are some of the labs I should begin to do, to look at, to begin to have a conversation with my medical provider about undertaking this?
It's really in perimenopause that we start really thinking about estrogen and progesterone, testosterone, and that can be anywhere in the kind of 5 to 10 years before menopause. Menopause onset average age is 50, but some women, go into menopause at 45. So you may be having these symptoms starting at like 35 or 40 for perimenopause. And that is, the symptoms are usually things like weight gain, or you're not sleeping very well, or you're irritable or anxious, or you're having headaches before your periods, or things like this that just changes in those hormones initially because of loss of progesterone. And so when those symptoms start, anywhere from like 35 to 50, it could be perimenopause. We start thinking about, checking hormones. Usually I just do blood tests. I think blood tests are still the gold standard for checking hormones. I don't think that the urine tests are nearly as good. And so we do blood tests. The estrogen, progesterone don't really, they go up and down so much during the month that they're not all that helpful. But when we pair that with symptoms in perimenopause, we can start deciding if you need a therapy. And then certainly as you get into menopause, even if you didn't have symptoms, I tend to recommend considering hormone therapy in menopause.
And for someone who's gone through that process and then made the decision, yes, HRT, something you posted recently on your Instagram I thought was interesting was pharmaceutical hormones versus compounded. Can you talk a bit about that, the differences between both options and the pros cons?
Yeah, absolutely. So, in the old days, they used to use synthetic estrogens and synthetic progesterones or progestin. And those are the hormones that were used in that Women's Health Initiative, that increase cancer risk, that increase heart disease and things like that. Most of us don't use those synthetic hormones anymore. We use bioidentical or body identical. They're the same thing, really. Hormones that essentially match the same hormone chemical structure that your body makes. So the body identical hormones, they can come from a compounded pharmacy, or they can come from a pharmaceutical company. And the actual chemical is the same. So you can get them safe hormones from either place. And I think that this is, there's like a weird war in the hormone space where you have like traditional doctors who are like, we only prescribe FDA approved medications from big pharma. And then you have these like naturopathic doctors who are like, we only prescribe compounded medications from these, small pharmacies and whatever. And I think that the reality is you can get quality hormones from either place. And we need to be focusing more on getting this information and getting these hormones to women, because many women have no access to hormones, than we do on, debating the merits of compounded versus pharmaceutical. But there are benefits to each one. It just kind of depends on what you're looking for.
So you mentioned traditional doctors, and maybe this is a good opportunity to talk about your journey, because you were as traditional as they get. You were an ER physician, and now I would say you practice regenerative medicine, longevity. How would you describe your practice today?
Yeah, I don't even know what to call it. I keep changing the name of what I do because there's not really a good name. But I do sort of longevity medicine, regenerative medicine. I do a lot of stem cell medicine. I do sort of proactive preventative medicine. And I was an ER doctor for 10 years. That was my initial training. Board certified in the ER. Worked in the ER for a decade, and I left the ER in 2013 because I was ready to learn something new. I felt like that we were really failing the system was failing a lot of people. I remember one day I was at work, and my kids were little. I had 3 kids under the age of 2 at the time. And my husband had moved out of state for a job. So I was alone, essentially taking care of these kids. I was getting up at 3:30 in the morning to go to work because I was working full time in the ER. And, as you might imagine, I was just completely wrung out, wasn't sleeping, wasn't eating well, like just everything, super high stress. So not doing all that well. And I remember I was at work one day and I looked out at all of the people in the waiting room who were waiting to get seen in the ER. And it struck me that if I didn't change something in my life, that I was going to be one of those people in 5 years or 10 years with a chronic medical problem that probably could have been prevented if they had education and took action. And that for me was a pivotal moment. Like, Amy, you have to do something. You are falling apart and you're failing yourself, and you're going to fail your family if you don't start, doing something different with your life.
Wow. So how many years ago was that now?
That was 2013 is when I left for good. But, started learning about some of this new stuff in about 2011, 2012.
So in terms of the quote unquote new stuff, you practice a lot of it. I'm curious, what do most people come see you for?
So I have the main clinical practice I have right now is stem cell practice. I see patients I do stem cells and regenerative therapies for skin and scalp hair restoration, skin rejuvenation, and sexual health. I also have another practice where I don't see patients currently, but I've overseen the patient program for a long time. It's a big hormone practice here in Utah, and then I'm starting a new venture. We're actually launching some clinics in Texas this month called Humanot, where I'm the chief medical officer, and I've created all the clinical protocols for all the hormones and peptides and kind of preventative medicine and advanced diagnostic testing and all the things for the providers there. So we're eventually going to franchise that out, and it'll be a whole system. So, and I'm the person kind of behind the scenes. I have a team, but trying to figure out how do we bring this kind of new thinking about being proactive and preventative and using technology to the masses.
So you mentioned stem cells. No shortage of controversy there, definitely on the bleeding edge. Can you talk a bit about what are stem cells at the highest level and the use cases? I heard essentially sexual health and skin health.
Yeah, well, and we also, I mean, of course, certainly we also do musculoskeletal, like joint injections, back injection, things like that. But stem cells they're the cells in your body that are responsible for the general upkeep of all the different organs and tissues in your body. And so they have the ability to replicate themselves, and they have the ability to turn into other types of cells. Those are kind of the two main qualities of a stem cell. And if you think about it, like for instance, if you cut your arm when you're out skateboarding, you have this injury, the stem cells are the ones that then go to the area and they send these messages out to all the cells around it and say, hey, we need some good blood flow to this area. We need to heal the tissue. We need some more collagen. Like they kind of direct the healing response in that tissue. And what happens is as you get older, you have fewer stem cells in different areas of different tissues. And the ones that you have, they become less active. They become less able to send out those signaling, responses. And so you can imagine, like if you're 8 years old and you cut your arm, it heals like that. Like my kids, they heal like that. If I have the same injury, it takes me, a week or two to heal. And it's because I have older stem cells. And so the idea with stem cell therapy, whether you're actually giving actual stem cells or you're giving other types of exosomes or things like that are essentially acting like stem cells, you're just trying to signal your body to heal itself in the way that it used to.
And so why so controversial?
It's controversial, initially in the kind of the old days in the 90s when stem cell therapies first started being talked about, they were using fetal stem cells. So they were using stem cells from like 8-day-old fetuses. And as you can imagine, people didn't love the idea of taking a live 8-day-old fetus and then using its cells for something else. Those are called embryonic stem cells. No one is using those stem cells. We haven't been using them for many years. Now we use either stem cells from the patient, so we could use your stem cells, like you have stem cells in your fat, you have stem cells in your bone marrow. We can take either of those out and concentrate them and put them somewhere else. So like if you have a knee that's hurting, rotator cuff injury, if you want to regrow your hair on your scalp, like we can essentially use your own stem cells that have just been stored in your body, and we can do that. Or we can also use like placental or umbilical growth hormone tissues from C-section deliveries, donated tissue to the lab. That is certainly not something that everyone is doing because there is a lot of controversy about it. We'd be very careful on what we say and make sure that we're not trying to treat anything specifically. So there is a lot of controversy out there. The FDA doesn't love people being able to use their own stem cells to heal themselves. But, we're trying to do it in a way that is both is legal and also is going to be able to help people with whatever they have going on.
So since the promise, if you set aside the joint health, in terms of the skin, would be younger looking, more elastic, youthful skin.
Yep, exactly. Yeah, you're trying to increase collagen, elastin, hyaluronic acid, all these things that start to go down at about age 30. And there are plenty of studies out there now that show us that by injecting either stem cells or exosomes or other kind of growth factors from some of these placental or umbilical tissues, that you can do that. Same thing with hair. You're trying to regenerate hair, so trying to get the hair cycle to move from the rest cycle to the active cycle. So as you get older, especially a lot of men get male pattern baldness, women get female pattern baldness. There's obviously other things that cause hair loss, but all of that is basically the hair follicle spending too much time in this resting phase, and then eventually you lose the follicle completely and it just dies off. And so the idea behind stem cell therapy for this is trying to essentially activate that follicle to act more youthful again. And so, trying to regrow hair and also create hair that's thicker, density is thicker, things like that.
So I know this is like a generalization, but if you had to guesstimate, is it going to shave off, 10% in terms of years or 20%? Like how far can the treatment take us in terms of taking back the clock a little bit?
I don't. It's a hard question. I don't think it's probably more than. There's no. Obviously, we have no studies that say this is going to reverse your age this number of years. As far as aesthetically goes, you certainly can. You get more youthful skin, so you can look 5 years younger, 10 years younger, but it's not going to help with things like volume, like if you lost facial volume, which is very common as you get older. And it's not going to be a facelift or it's a surgery. So these things can definitely help, but they're not the end all be all. You also want to continue to do some of the other more traditional therapies also.
And so you also mentioned sexual health. What's the use case there?
So we can treat men and women. Honestly, treating men is one of my favorite things for usually erectile dysfunction, and usually it's just age-related. Loss of blood flow that comes with age certainly also can be worsened by diabetes or high blood pressure or just kind of chronic diseases. But there's actually quite a number of lots of animal studies, some human studies, but injecting these regenerative cells or factors into the penis, just 2 little injections, super easy. We numb you first. And what we see in animals and the humans that have been done is increasing blood vessel formation, so new blood vessel formation. We can see improvement in the health of the cells in that tissue. So for instance, the elastic smooth muscle cells in men that as you age get turned into fat cells, or they get turned into scar tissue. So you're not able to actually get a full erection because of that. And so if you can turn back the clock where you essentially have those smooth muscle cells that are very elastic again, then you're actually able to get an erection and keep it again. And so we use that for men. We also use it for women. We are able to inject the vagina and the clitoris, trying to, again, increase blood flow, decrease inflammation, decrease scarring, improve pleasure, things like that.
So you've mentioned blood flow a few times, and I've heard you talk about nitric oxide. And I equate nitric oxide with blood flow. So can we talk about the lifestyle intervention of perhaps, beet powder or beets or nitric oxide in general, why it's so critical to blood flow?
I love nitric oxide. So nitric oxide is it's the main chemical messenger that essentially tells your blood vessels to vasodilate, to get more open, bigger, to get blood flow to different areas. And nitric oxide production also goes down as you get older. So nitric oxide is made by the cells that line your blood vessels. So as you get older, your blood vessels get older and those cells become less able to make nitric oxide. So by the time you're 40 years old, you're making about half as much nitric oxide as you were when you were 20 years old. And so this is important for everything from, getting blood flow to your muscles when you're working out, to your brain, and certainly to your sexual organs in order to have erections. Both men and women have erections, by the way. So we start to see a big drop off in the ability to get and maintain erections because of loss of nitric oxide as you get older. So one of the things you can do is you can intake nitric oxide into your diet. So usually it's in the form of nitrates, like from fruits and vegetables. So that's going to be like beets, like you mentioned, or beet powder, or other vegetables like green leafy vegetables, arugula, kale, things like that. Some of the citrus fruits have it as well. And so you can eat those foods and your body can make nitric oxide from it. However, you have to make sure that 2 things are happening. You have to make sure that you have the healthy bacteria in your mouth. So you want to make sure you're not using antiseptic mouthwash every day because you're destroying those healthy bacteria. So you need the healthy bacteria in your mouth, and you also need a stomach acid. And so if you're taking like a medication that blocks your stomach acid, like a proton pump inhibitor, that could affect your ability to make nitric oxide. So essentially you can get it from food if you don't use a lot of mouthwash and acid blockers. And then you can also get it from exercise. You can get it from sunlight. You can get it from red light therapy, PEMF therapy. You can increase it from just breathing out in your nose instead of your mouth. So that's where where mouth taping and things like that come from. That can actually help with your nitric oxide levels as well.
How do we measure nitric oxide levels? I do extensive lab testing, but that's like, I'm thinking one thing I don't really test for.
Yeah, it's there are some saliva kits you can get. You can get them on Amazon that are just like little saliva strips that you just put on the strip and it just changes color. It gives you like a color zone, like your pink or your red. Like it's not like an actual number, but it can help you kind of get an idea where you are. The problem is it's a very fast. It's a gas in your blood, and it's only there for moments. So it's very difficult to measure it on a blood test. So right now, the easiest thing that we have is the saliva strips.
Interesting. I think I'm going to have to pick that up. The decline at 40 is pretty scary for half of what we are at 20.
It is, and it just keeps going down. It just keeps going down.
Right. Well, what's so interesting is we've come so far in the longevity conversation with like whether it's hallmarks of aging or like nitric oxide for one. Like there are things we know that rapidly decline with age. And then the question becomes, well, what's the potential lifestyle modification or pharmaceutical intervention to stop this thing from declining? And there's a lot we can do.
Yeah. And with that one, there are some supplements that have some good research behind them too for nitric oxide as well, like the Neo 40 or the NO2U. And I don't have any relationship with those companies, but they have got some good research behind them. So, some of these things, there's some things we can do. Obviously, there's other ones that we don't know what to do about it, but we just know it's probably important.
And so you also mentioned collagen and hyaluronic acid earlier. I'm assuming you're a fan of ingesting both.
Yeah, I like both. Yeah, I like collagen peptides for skin as well as for bone health. There's also some for joint health and things as well, but I especially like the skin and the bone ones. Verisol collagen for skin it's a branded ingredient that's in a lot of different brands, and then Fortibone for bones is great. That it really helps. It's helpful to giving the skin structure as well as bones. Bones. It's interesting as you get older. Your bones, you lose mineralization, you lose your calcium and things like that, and you can replace those, but people don't think about the collagen part of bones, which is actually giving the structure around which the minerals kind of hang out. And that also goes down as you get older. So especially for women, speaking about women, we talk about the importance of bone health in women because that's such a big deal for us when we lose our bone health and we break our hip or whatever. So I like collagen for that. Hyaluronic acid, I like a couple 100 milligrams a day as well for skin. There's some decent studies with that as well. You can take those orally.
And so I want to come back to red light and PEMF. Can you talk about use cases for both?
I think red light has so many great use cases. I started using red light on myself about 10 years ago, just for skin health. I had like a wraparound light that I would lay in and I take a nap underneath it. And, there's a lot of studies with skin health, improving collagen activation, improving wound healing as well. If you have like any kind of like facial anything, injections or surgery or lasers or things like that, using red light after it is fantastic to improve the speed of wound healing. But there are so many other things. We know that red light therapy basically increases your mitochondrial ATP or energy production. And so that's helpful, in various parts of your body. There's some recent studies that show that using red light therapy can actually help to keep your blood sugar down. If you use red light before a meal, your blood sugar may not spike quite as high as it did otherwise. It can be helpful for recovery, certainly from exercise, for energy, things like that. But there's a whole list of good reasons to use red light therapy.
What about PEMF?
PEMF, I have used it a little bit. I'm not an expert in PEMF. I do like it for healing. And, you're basically changing the electron gradient in the cells and trying to promote a healthier electron gradient. And so it's kind of like grounding, if just walking out barefoot, but it's sort of to a higher degree and trying to move those electrons around. And I've used it for healing various things. I've used it for sort of pelvic floor healing, but also for musculoskeletal healing and just trying to improve, get, better blood flow, less inflammation, faster healing.
Jason Walkup here, founder and co-CEO of mindbodygreen and the host of the mindbodygreen podcast. Please subscribe. You'll never miss a show and you won't regret it. Of everything we've discussed, I'm curious, like, what do you do daily? Like, what's your daily, you're a mom, you've got 3 kids. Your kids are probably teenagers now, right?
Yeah, they are. Yeah. 14, 16, 16.
Wow. Wow. That's another conversation. Like you're a busy mom, you've got a practice in Utah, you're opening a practice in Texas. You are short on time. Like you are not a biohacker who takes 3 hours for their morning routine and then posts on social media and then takes a nap.
I'm not. But no, the things that I do regularly, I exercise. I try to do weightlifting, walking, a lot of walking, and weightlifting at home most of the time. I have a total machine, which is awesome. I do cold plunges in the summer. I don't do them in the winter as much. I live in Utah, and I find that if I do them in the winter, I stay cold the entire day, and I cannot warm up. I'm pretty thin. I don't have a lot of body fat, so I do what makes sense for my body. But I do love cold plunges in the summer. I do have a sauna. I tend to use a sauna more in the winter, just because it takes a little time. But I'll do like meetings and things in my sauna, and so I can be on a Zoom call and such in my sauna. And then I do red light therapy when I'm blowing my hair dry, which is just a 10-minute session. Those are kind of the main things I do on a daily basis.
Are there any that you think, we've talked a lot about the women practices that you're seeing on social media and maybe the men do? I think the men like are a little bit more gullible, that you think are potentially overrated.
I don't know if it's just men. I think the things that I think are overrated in general, I think like big detoxes, I think are really overrated. There's no really, certainly there is a time and a place for like a physician kind of overseeing detox, but most of the time just, drinking a certain tea or abstaining from, certain foods for a period of time. I don't see that helps a lot of people. I also don't like alkaline water is one of the things that drives me crazy. I don't know if you've seen that. It's been going on for years, but the idea that you could drink water that's more basic than regular water and somehow that makes you healthier, it makes me crazy because it discounts the fact that if you actually change the acidity of your blood, that you would die. Like you cannot, like it is so, your kidneys and your lungs play such a role to keep your pH of your blood exactly 7.4. So the idea that you could just drink something and that it would change your body chemistry in a positive way is just completely ludicrous to me. So there's certainly things that I have opinions on, but I don't think it's necessarily women or men. It's just like the wellness culture in general.
What about the water fast?
I think fasting's interesting. I think that there's some good science behind the benefits of fasting, but I also think it's kind of swung a little bit in the other direction. We've seen in animal studies, we know that intermittent fasting or fasting for a period of time, caloric restriction and fasting can increase lifespan in animals. And so this is, across multiple species, we've seen this, but we really haven't seen, of course, it's harder to study in humans, but we haven't seen some of those same indications in humans. And so I don't know that it's going to be as important for humans as it is in animals. I think if intermittent fasting makes you feel good, then there's certainly, if you can do it safely, that's great. I don't do a lot of, at least not long fasting for it myself, because again, my problem is that I'm too thin and I have a hard time gaining muscle. So the last thing I want to do is go on like a long fast where I'm breaking down muscle. So I think it's dependent on the person.
You mentioned detox and I brought up water fast. I think we went from this place where wellness culture, specifically, I think wellness culture focused on women, unfortunately, was about restriction. And I like how I think the pendulum swung the other way, where it's about eating more protein and lifting, and you don't need to restrict. You don't need to lose weight. You need to do a body recomp perhaps and turn that into muscle, and you need to eat more, and it's empowering. And I think it's just, and I can't believe like, wow, like we really did this for a long time.
Yeah, I totally agree. I love that the messaging now for women is so much about protein and lifting weight. So that's something that I think a lot of women still don't do those things. And I have a hard time myself getting that much protein in, but I know I should at least. And so that's something. It's a step in the right direction.
Well, the other, like, I think big change I've noticed, like lifestyle intervention and pharmaceutical intervention, if you will, like kind of coming. I remember a decade ago, there was a lot of stigma around, oh, wait, are you taking a whatever it might be? And now that's not the case, whether it's, rapamycin or a low dose GLP-1 or peptide, like GLP-1 is peptides, Botox, regenerative, like microneedle, like all these. So like, can we spend a moment on what you see in that world, whether it relates to skin health or longevity, where you think the tide has turned and it's become acceptable, it's exciting, and there are longevity benefits potentially?
Yeah, I love this question. I've always been a fan of. I'm not so much necessarily an everything that should be natural person. I'm more a fan of everything should work and be safe and not be dangerous person. And so, so people come on my Instagram and they're like, I can't believe you'd recommend that. It's not natural. And I'm like, there's a lot of things that are natural that are dangerous. And there are a lot of things that are not natural that are completely safe and efficacious. And I think that, you bring up several, like rapamycin. I'm a big fan of the idea of using sort of the, once weekly or sort of the longevity dosing for potential lifespan benefits, potential, fertility benefits, ovarian aging, those things like that. Obviously, the research is still early days, but the benefits could be pretty big and the downsides are pretty low. I'm also a big fan of the GLP-1 medications. Certainly, they've gotten some bad press, but I think that when used correctly, like you mentioned, in the low doses and the right people with the right monitoring, they are probably the most powerful drugs that we've had in the last 50 years. Like, they are so powerful and they have so many benefits. When I think that we're just learning how to use them properly, but when we do, we'll be using them for everything, for cardiovascular disease prevention and liver health and kidney health and probably skin health and bone health. I mean, I see them really being quite ubiquitous, but again, used in the right way, in the right doses. So I just think it's important that the discussion remains what's safe and what's effective. And that could be pharmaceutical, it could be lifestyle, it could be something else, gene therapies, it could be, and to me, we have so many options to pull from, but we just always need to focus on what's safe and what's effective and then use what's out there. Like, we have so many great things available.
Yeah, and you gotta dial in lifestyle first. Like, surgery and medication aren't going to solve all your problems. They can solve a lot of them, and maybe in the short term. But you gotta you gotta bake the cake before you put on the frosting. I view a lot of the pharmaceutical interventions as the frosting, but you gotta get the foundation.
Yeah, I think that's true, but I also think that sometimes putting the frosting on first helps you bake the cake. Sometimes, like for instance, with testosterone therapy, if I have a guy who's in his 50s and he's overweight and he has no motivation to go to the gym because he has low testosterone, which is, partially because he's overweight. If I give him testosterone, then he has the motivation to go to the gym to start lifting weights, and you have this chicken and egg effect, right? And so I think that certainly lifestyle is always important, but I do think that there are sometimes indications for using therapies, even before or with lifestyle changes.
That's a very fair point. And on the subject of testosterone, what's your take on when and what levels for a man, and at what age? When more is what age?
Yeah. I prefer not to actually give testosterone to men under 40-ish. I mean, that's, everyone's a little different. Because usually if they're less than 40, they respond to other things like enclomiphene or Clomid or HCG or some of the other drugs that will help them to make their own testosterone. Because, once you start giving someone testosterone, then obviously they're not making their own testosterone, and that their testes shrink, they become infertile. There's some downsides for sure. And so I do like to wait, if we can, until we know that they can't make their own testosterone. But as to levels, I definitely think it's about symptoms and how you're doing, how you're feeling. It's not necessarily the number on the lab test. I think, it's important to look more at free testosterone than total testosterone. That's what's available. But the lab reference range is it helps you. And if you're at the lower end and have symptoms, that's a great indication that you could use help. But sometimes you have people who are right in the middle of the lab reference range, and they still have really bad symptoms, and they could still use help with testosterone. So I think that the important thing with hormones is we're only seeing, in the blood, you're only seeing one part of the picture. You're seeing the blood hormone level, but you're not seeing how the receptors are behaving, or how many receptors you have, or what's happening in the cell once it binds to the receptor. Like, there's all these steps that we don't see by checking your blood test. So it is certainly possible to have sort of testosterone, low T symptoms, but have a kind of average range testosterone, and potentially still respond to testosterone therapy.
Right. Consistent with what I've heard, it's an ongoing conversation I've had with my doctor, Frank. I'm 50. I'll turn 50 very soon, and my testosterone is like the 500 range. Not terrible, not great, but I don't really have any symptoms. And so I'm kind of like, I don't know, we'll see how it goes. But once you go on, you're on.
Yeah, I mean, you obviously can stop, and eventually, if you were making testosterone before, you will eventually make it again at the same level that you were before. But it is hard. It's harder, especially as we get older, to stop it because you're just making less and less and less. But I agree. I've had people who have testosterone levels of 350, which is very low, but they feel totally fine. And so you do really have to weigh both things.
And then the question, what the doctor would say, well, imagine what you'd feel like if it were 900, how much even better you would feel. And I was like, oh, fair point.
That's a good point. You might feel better.
And what's your take on Tungkat Ali for testosterone?
I've seen it raise testosterone a little bit if you have pretty low levels. So if you're 200, 300 kind of low level testosterone, maybe it raises it 100 points or 200 points. I haven't seen it raise levels much in people who have kind of mid-range testosterone. 500, 600 total. And I haven't honestly seen it make that big of a clinical difference. So even if it raises the blood level a little bit, in most people that I've seen take it, they don't feel a difference. So I think it's fine if you give it a shot. But at the same time, most of the testosterone kind of booster supplements don't end up working out all that well, in my experience.
Right. So it's my view that within the next decade, those who consider themselves health forward, if you will, and educated, I think you're probably going to be on some sort of hormone therapy, whether it's HRT for women or testosterone for men at some point. I think we're getting there where it's like, okay, I'm educated. I got like lifestyle dialed in, like I'm doing this. I think that's in the future. I'm curious what you would add to that list for someone who's health forward, doing all the right things, feel good, and they just want to feel good for a lot longer. Like what else is going to be part of their stack?
Rapamycin, we talked about. I think that that's something that is probably going to be in most people's stack, at least people over the age of, 40, 50, something like that. I think some of the peptides.
Do you take rapamycin?
Yeah, I've been taking it for like 5 years or something. Like I was a kind of an early adopter, but just low dose, like 5 or 6 milligrams a week I take, and it's fine. Like I don't feel any benefit. I don't know if it's helping me or not, but I also don't have any side effects, so I'm okay with it. I also there's a lot of peptides that are out there that I think can be beneficial, and obviously it depends on kind of what's happening with the person. But doing sort of cycles of different peptides can be really helpful, and I think that the more proactive physicians that are out there and have access to those peptides are kind of hard to find, but at the same time, those are great things to know about as well. And then I also think that probably some of these pharmaceuticals that we mentioned, like the SGLT2s, which we didn't talk about, but that's another medication that's out there, or some of the lipid lowering medications like the PCSK9s, I think that we'll start to see people taking some of those sort of as a preventative or proactive, and the GLP-1s, of course, to help to prevent, problems in the future, like prevent dementia, prevent heart disease, even if you don't have a lot of other reasons to take them.
So the PKS9, I think, are kind of getting on the map. Peter Attia made a big deal about that with lowering ApoB. So I agree with you there. And so we've talked a little bit about that, but what are SLG2s?
So SGLT2s are diabetes medications, and it's a class of medications that's just approved for diabetes, but there are a number of studies now that are showing, kind of like the GLP-1s, that they actually may prevent other problems. They may be helpful for preventing dementia. There's some studies with chronic kidney disease and helping to reverse that. There's some studies with heart disease and helping to potentially reverse some of the problems with your heart disease. So it's helping with blood sugar, probably has anti-inflammatory effects, probably a lot of the same types of effects as the GLP-1s, except doesn't cause weight loss. So that's a whole group of medications that it's getting studied, but it's definitely on a lot of our radars in terms of like, should I be taking this, just for like longevity purposes? I'm not taking that right now, but it's something that I've looked at.
What else are you personally experimenting with?
I did metformin for a little while, but then I stopped that one. And then I have a supplement company of my own called Hotbox, which is what the hop appears for. And that's 19 ingredients in little packs that you just take a pack or two a day. So I take those. So it's a lot of different of the supplements that are in there, spermidine and NR and hyaluronic acid and, calcium alpha ketoglutarate. There's a whole bunch of 19 different ones. So I take that every day. I don't have any other medications. Oh, I've done growth hormone on and off, HGH, which I think is, there's a lot of peptides that can increase your own growth hormone. And then you can also just take HGH itself. And so I've experimented over the years with either taking peptides to increase growth hormone or just taking growth hormone. I've done a number of different peptides over the years. Right now, I'm doing just an oral BPC 157 that has AOD 9604, which is another growth hormone, kind of small. It's like a part of a growth hormone. I take that one orally. So I don't know. I'm kind of a guinea pig.
So why that one?
That one is a really good for it. It's a supplement called Rapid Rebound, which is another one of my companies. Not trying to promote myself, but it's basically the BPC and the AOD are helpful for recovery, like workout recovery, like getting you back, like getting your body back to the gym faster, recovering from aches and pains, recovering from musculoskeletal injuries. And I found in the last 6 months, I'm 48. I found in the last 6 months or so that my body is just sore all the time. Like I wake up and I feel like I've had this massive workout the day before, even though I didn't work out. And sitting on a plane for 4 hours makes me ache and, have aches and pains everywhere. So I've been trying to be more proactive in terms of how do I prevent my body from feeling like I just ran a marathon yesterday when I didn't.
Wow. And so far, so good.
Yeah. I mean, I think it helps. Everything, it's all a big experiment, but I'm always trying to figure out how do I make myself feel better, and then how do I bring that to my patients, and then to anyone who follows me.
So on that note, you're very much a tinkerer, and you're doing your N of ones, and then working with patients. I'm curious, is there anything you've changed your mind on recently?
Yeah, metformin was one thing that I changed my mind on. I think that, in the early days, 5 years ago or so, we were pretty excited about metformin as potentially being another, longevity drug. I think the pendulum has swung back the other way. Maybe it's not. So that was one. It also has a lot of side effects, a lot of GI side effects, and really kind of a hard drug to take. That's the biggest one. I never really got into there's a lot of wellness biohacker stuff that I just never really got into, just because some of it's hard, it's expensive, it seems silly. And so I didn't even get into some of that stuff.
What's an example?
I know, I try to think of one. I knew you were going to ask that. What is an example? I can't even think of one. I try to think of the biohacker conferences I go to and the things that are insane or dumb, but now I can't even think of what it is.
Alkaline water.
Alkaline water. Oh. I hate that stuff.
So where do you think we're going? Where do you think we're going to be talking about in, say, 3 to 5 years when it comes to longevity and women and the conversation?
I'm hoping that in 3 to 5 years, all women have access to just basic hormone replacement therapy. I think that is still probably not going to happen, but I'm hoping that is the case. And then I also think that, there's so much research being done, obviously, into, cellular reprogramming and gene therapy and, clotho injections and all these different things that are being experimented on in animals and just showing amazing results. And it probably won't be 3 to 5 years, but maybe more 5 to 8 years or so. I'm hoping that we're starting to do that in humans. Gene therapy, we already are, but on a larger scale, and humans, and actually being able to turn back the clock. Right now, we can't stop the clock. We certainly can't turn it back. We can maybe slow the clock, but we don't even know that for sure. We're still kind of fumbling around. But the hope is that in the next 5 to 8 years, we can start seeing therapies that could actually start turning back the clock a little bit. And that'll be super exciting.
I agree. We covered a lot. Is there anything we didn't touch on that you would like to cover before we close?
No, I mean, the main things are, if you don't follow me on social media, I'm on Instagram, Dr. Amy B. Killen. I talk a lot to women, but sometimes I speak to men too. So come aboard. And then would love to just plug my hotbox.life, which is a supplement company. And then if you're interested in the longevity clinic that we're launching, it'll eventually be nationwide, but right now in Austin, it's called Human Health, like astronaut, but human Health. So check that out also.
Amazing. You got to bring it to Miami.
Yeah, we will. I think we're gonna do Florida. I think our third store. So we're on the map.
Oh, awesome. Well, thank you so much, Amy.
Thank you. This is fun.